Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. By July the 4th, the world's confirmed COVID-19 cases had passed 11 million. The USA had 25% of that number, and Brazil had about 14%. There were more than 5.8 million recoveries, representing about 53% of global confirmed cumulative cases. There were also more than 525,000 deaths. In Nigeria, at the same time, there were over 27.5 thousand confirmed cases, over 11,000 recoveries, and 628 deaths. Lagos had close to 11,000 cumulative cases, about 40% of all cases in Nigeria. The number of infections in Nigeria has been rising at a daily rate of over 400 to almost 800, with authorities saying we are still in the active stage of transmission and are yet to peak. In the midst of this, students in graduating and transitional classes are going back to school. My guest today is a public health physician and founder, Adolescent, Girls and Women Development Initiative, Dr. Kemi Kiladejo. You're welcome to the show.
Thank you very much, Mary. Nice to be here.
Now, let me start by asking you to walk us through the possible levels of safety that students must go through. Let's think about the precautions they have to go through, interstate travel, and who monitors how the students travel back to school. If they have to use buses, for example. Just walk us through that.
Okay, so I think that one of the things we need to establish is the fact that COVID-19 has come and is presently with us, and we need to really learn to adjust to our new normal while working hard to get a more holistic solution or a cure to the disease and then a vaccine as such. But meanwhile, we have to get used to our new normal. And what is the new normal? Is to live with it. And how do we live with it? By doing our best to resume all our usual activities while still maintaining the precautionary measures. And then back to your question on students, schools, traveling from home to schools and all of that, and who monitors how they follow these precautions. I would answer by first saying one of the things that the Presidential Task Force has been emphasizing in the last couple of weeks is taking responsibility. And I want to believe that the group of people in the Presidential Task Force, the team, constitutes parents and grandparents who also have children in school and are concerned about the health and the welfare of the children. And so many of the decisions that has been taken to ensure that the students that are writing exams go back to school, I believe they're well thought out. And I also believe that these are decisions that are taken after weighing all the available options. They're probably taken to see that this might just be one of the best options available at times like this. But this is not without its own risk. We know that COVID-19 is highly infectious. We know that COVID-19 is more easily spread than many of the diseases that had been with us in the past. And so what we can say is that we continue to do the right thing. We maintain high sanitary hygiene.
Let me just cut in there for a moment. Are you saying, for example, that because these students are going to have something like classes, some classes to get them ready for their exams before they actually go into exams. So maybe the school day starts at 8 and it ends at 2. Will they be wearing masks all day?
Yes, so that's part of the new normal I'm talking about. So let me just expatiate a little more. These are some of the basic things that should be put in schools. We should have booths for washing our hands, where we can have foot pedals, and then they can just have the sanitizers there all over in the school setting. Secondly, this is the time where we can say that we should have masks available for every child. And so when you come from home, I think it's just right to drop the ones you come with from home, and then you get your mask. You wash your hands before going into school, and you'll be handed in masks that are comfortable, you know. Okay. I mean, the health workers stay in the hospital all through. and they put on their mask from morning till evening, and then they have to wear their mask back home. And I haven't heard of anyone that died as a result of putting on the mask. So the children need to put on the mask, and also it will be nice to have a face shield, because I realize that when one puts on the face shield with the mask, not without the mask, is even when you want to put your hands on your eyes, it's so difficult because you find out that there's a barrier you hit first of all. When you hit the face shield, then that brings it back to you that, oh, you're not supposed to put your hands directly into your eyes or your mouth, not bearing in mind that some children still suck their hands and do all kind of things. But we need to take responsibility, not just the children, but it's about the monitoring, the proper monitoring of these measures that is most important. And
That's
how
right.
do we
So
monitor?
let me just
Okay.
remind you. You know that South Korean students did try to go back to school. They went back to school and there was a spike in infections. They had to send them home. I wonder, do you know where they went wrong? Is there something we can learn from that?
Okay, so like I said, whether we keep them at home or we take them back to school, it's already a risk. Keeping the children at home, exposing them to rape, let's not forget that parents are already, many parents have resumed back in their workplaces. We do not have a total lockdown again. So
No, we
parents
don't.
go to work. Yes, so a lot of parents now go to their workplaces, people go about their businesses, and we leave the same students at home. And so they are exposed to all sorts. We're not sure if they are really at home or they're going visiting their friends and all of that. So whether we keep them at home or we take them to school, it's already a risk. But I want to also, thank you for sharing the example of the South Korean. If we go to the Scandinavian countries, we realized that they also had a good model. Schools have been open for 1 month and we haven't heard of any crisis. What did they do? They avoided crowded places. They avoided confinement. They even took the students to places like large fields, their stadium, and they ensured that they had open place and they were able to maintain the 2 meters distance. And we haven't heard of any crisis thus far. So I think it's about doing things right, the right way, and monitoring that it is properly done to achieve the desired result. Now,
Okay,
the other thing that we must,
go ahead, go
okay.
ahead.
Yeah, another thing we must take into consideration is we need to ensure that even the caregivers and the parents are properly trained on how to monitor this process.
Okay, let me quickly
And
ask
yeah,
you, every student by now knows that they're not going to sit close to their friend in the classroom. There's going to be some space between them. Everybody understands that now. But do we have the capacity to decontaminate schools as often as they should be before the students come back for another school day?
okay, so talking about the contamination, we need to understanding the way the virus is being spread. It's majorly spread via respiratory means through droplets, right? So
That's
if that
correct.
school has been empty, yeah, if that school has been empty for some time, it's human beings that carry this virus around. If the school has been empty for some time, and you know, there's a specified period where the virus can die on surfaces. So one of the things that we must take into cognizance is that the school is not likely to be contaminated. And we also, like I said earlier on, enforcement is what is important. Yes, like you said, a lot of people know the safety measures to take into consideration, but how do we ensure these are being done properly? That is our major emphasis. And this is not far-fetched. It's by government and every stakeholders engaging consistently with the leadership of the schools. When we engage with the leadership of these schools and we take ownership for the actions, not expecting the government in Abuja or the government of the state to come to the school to take responsibility, but let the schools take responsibilities in cognizance together with the Parent Teachers Association of each school. Because if a child gets infected, eventually it gets to the family, the child can go home and infect the
Now,
more
that's where I'm
at-risk
going,
person.
doctor. What if a
Yeah,
child
yeah.
comes to school with an infection that is not noticed, maybe one of the asymptomatic ones, and they're in class and the thing is spreading? I'm talking about a decontamination after they have gone back to school, you know, to make sure, to reduce the possibility of other people getting it.
Yes, so we need to really be very realistic here. I have nothing against decontamination, and I am absolutely for decontamination if we have the logistics and we have everything in place for decontamination. But as a community health physician, we talk a lot about the basics.
Okay.
Where it is not possible to decontaminate regularly, if you maintain the safety precautions like hand washing, washing their hands, teaching, these are things that we need to start ensuring. Letting them wash their hands under running water for at least 20 seconds and then washing it the proper way, because it's not just washing hands, but washing it correctly before going into the school. Putting on their face masks correctly, not chin masks now.
That's right.
Handing them face shields and ensuring that each child has a pocket of hand sanitizer, however small, even if it means bringing little containers from home and then fetching it in as you're going into the classrooms, so that if you think you have touched some surfaces and you need to put your hands close to your mouth or nose, you can sanitize your hands. I think that those are more long-lasting solutions in the meantime than asking that every school be decontaminated on a regular basis. Now,
Okay.
that is not to say that I'm against decontamination. Yes.
Yes.
But
Okay.
we can still achieve the same result if we maintain the right precautions, if we maintain the sanitary precautions.
Is
Yeah.
there a particular way to use bathroom and toilet facilities, assuming we have boarding students, for example?
Well, I personally will not encourage boarding students at times like this. When we're talking about COVID-19, one of the easiest way to spread it is staying in crowded areas. So telling students to come, good enough, good enough. I remember that not all students have been called to school, and that is to prepare schools for the new normal. They have only called back students that are writing exams, students in GSS3, students in SS3, and all the students writing exams at times like this. And so there is still the opportunity to have sufficient spacing whereby people are not crowded in a place. And so that social distancing, even if someone coughs and all of that or sneezes, is not likely the droplet travels for so long to get to the other person if there's enough distance. And if everybody is putting on their face masks and putting on their face shields and washing their hands diligently as it ought to be.
Okay.
Also, going back to the boarding school,
Yes.
the reason why I'm not encouraging boarding facility is because looking at the ages of the students, you are talking of GS3, SS3, it's not likely that their dormitory mistresses will be with them 24/7.
That is
But
correct.
it's easier to monitor what happens in the classroom. If you're talking of a boarding facility for primary school, so you likely have people with them every single time, or even for GSS1. But at that age, at that class, you're not likely to be monitored at every second of the move. So and if you notice, adolescents and young people, this form an age where young people, where there is a lot of experimentation, where there is a lot of unrealistic expectations, and people can just say, oh, this COVID does not exist and all that. So young people like to try new things. They're a wonderful group of people. Let's not be negative about that. They're a positive group of people that their efforts can be harnessed for positive social change. They can be drivers of great social change. They have great potentials. But one of the things that is very common in that group is that they are usually restless, they like to try new things, and they are very experimental. So it's very, very difficult to put a young person in a hostel and say, don't go near your friend's bed.
Okay,
Or stay 2 meters
let's
apart.
explore
So,
some more of that in a minute. We are going on a short break. When we come back, we continue. Please stay with us. Welcome back. Call 0805-468-3514 for questions about going back to school in this COVID-19 times. You can also tweet at CTV_Mary A while we continue with the program. Now, Dr. Kiladejo, let's even talk about day students now. They go to school, have a full day in school, maybe interact a bit, and go back home. Is there any sort of isolation protocol if, for example, they have older relatives at home, people in their 60s and above, or parents with underlying conditions?
okay, so thank you for that question. Very important question, because It's very important for us to protect our older citizens. Um, the way we need to see it is, how is this infection spread? How is it transmitted? Majorly through the respiratory means, either through sneezing or coughing and all of that. And we have said it, and we will continue to emphasize that the best way is to protect yourself by putting on a face mask as much as possible when you have to interact with people, and by ensuring that you have maximum hand hygiene maintained and respiratory hygiene. Now, if all of that is taken into cognizance and obeyed religiously, it is not likely, it is most unlikely that these students will go home with the virus. Let me explain. Coming into school in the morning, washing your hands, well supervised. I'm not talking about just telling the students, wash your hands.
Okay.
Well supervised. And I talked about using the foot pedals so that you don't have to close the tap, open the tap, all of that can be complex and get one's hand contaminated again. Well supervised, and then being handed a face mask every day you come to school in the morning, and then giving a the face shield. The face shield, the children they have to be taught how to decontaminate it. So when you take that in, after school, on your way out, you need to dispose of that face mask. And probably the children must have come with their own cloth mask or some form of mask from home. And then they wash their hands again thoroughly in the proper way, well supervised before going home. If they are going to contact that infection again, it's likely in between school and home. And if they have been taught these habits, there's something about habits. Habit stays with you, and you find yourself doing it over and over. When a child comes to school and does this for 1 week, 2 weeks, the child is likely to, especially for young people, it's likely to become a habit. That when they get home, if they haven't washed their hands, they feel something is wrong somewhere. And
okay,
so
let's quickly, can I cut in
home,
here, doctor? Let's quickly take this call from David. Hello, David.
This is David calling from Abuja.
David from Abuja, are you still with us?
Yes, please.
What's your question?
Okay, please, I want to find out, right, when schools are resumed, have we checked the financial capability of some of these schools, if they'll be able to implement this hygiene that we are requesting for, putting up sanitizers, having water, running water, especially in rural areas where access to water is really a challenge? Have we checked the financial capability of these schools if they're able to maintain this hygiene we are talking about?
A valid point, David. So, doctor, the financial status of schools to actually implement all these things, because it's going to cost money to put up taps with pedals, soap, temperature checks. I suppose those will happen too. So has the government checked all those things?
Okay, very valid question. I must first thank David for asking that question. And then one of the things we must know is that COVID-19 is novel. Nobody planned for COVID-19. This time, August last year, I'm sure, Mary, that if I was on a show with you, we would not be discussing COVID-19. But when something is novel, we have to be proactive. For about 3 months plus, about 4 months going, we have been having to deal with this virus. Now, schools have been closed. That was being proactive also. But again, we have to look at it. What is the way forward? You see, we can't just be wishful that COVID-19 goes someday and then we open school. The best way forward is to look for how to minimize risk while still moving on with livelihood, with life and livelihood.
So get on with our lives in spite of it.
Yes, exactly. That's the most sustainable means. You know, when the lockdown was first instituted, it was difficult to get people to comply, even with the intra-travel bans.
That's right.
But even before the bans were lifted, do you notice people have started traveling across the borders?
They have been traveling. We've noticed that.
Yes, they have been traveling. Yes, because let me tell you the truth. Now, I am not in support of people breaking protocols, because the government have put these protocols in place because they believe that the life of the people are important to them. But at the same time, people need to also strike a balance between life and livelihood. They have to continue with their lifestyle. They have to continue life while trying their best to ensure they don't get infected. Going back to his question, that is why we do not have a homogeneous society. We have a heterogeneous society, a mix of different kinds of societies. And the government had given a lot of time for preparation. A lot of time for preparation.
Okay,
Not
let me
everybody
quickly
may have
ask you this because we don't
okay.
have too much time.
Okay.
A very delicate issue.
Can I just mention something? Sorry.
Yeah, go ahead.
Sorry. Yes, I just want to make this point clear. To those societies that are resource poor, we can have buckets in place that have taps.
Okay.
You know, we have these buckets that have taps where they can open it, and then they have tissue paper there so that they can use the tissue to open the taps, dispose of it. After washing the hands, you take a little tissue and close the tap and dispose of it. So places where you can't have the foot pedals, you can have taps, those small buckets, those buckets with taps, and have it a lot in those environments. I think that will work. Yes.
Okay, so now let me ask you, we are aware that some children have had this infection and they have recovered. Yeah. What if those children somehow they find out that such a thing happened? What are we doing about discrimination? Are there any rules? But let's quickly take this phone call before you answer that. Hello.
Hello.
What's your question?
Yeah, good morning.
Good morning, Professor Olabi.
Yeah, good morning. How are you today? My contribution is this, not a question. There is need for the government to be more serious about this program because what we are playing around with is a delicate situation. I expect every state government Ministry of Education to set up a monitoring committee that any school that does not meet with the required standards should never be allowed to open. Apart from that, there should also be a control measure with public health practitioners, like your guests of today, to come together and give us a strategy that will not cause more calamity for these children. Children, they are innovators. They want to discover new things. And if you leave them alone without proper control, it's going to be a little challenge.
Thank you so much, Prof.
For private schools, we need to be very, very careful. Many private schools may not have the facility required. There is need for a borehole in every secondary school and primary school now for them to be open, because where do you get water supply?
That's right.
And when they are opening the tap, they are still using their hand to touch the tap. That series of people will be touching the same tap at the same time.
That's why the pedal is
going to
advised.
Prevent contamination with that.
Thank you very much, Prof. So, Doctor, back to the discrimination question. Yeah. Let's do that quickly.
Yeah. Okay, so it's, discrimination has always existed, and these are things that we have to use every bit of power that we have in a sane way to fight. Stigma came with HIV, stigma comes with sickle cell, stigma comes with albinism, stigma comes with almost every novel thing that comes up, novel disease. And there must be structures in place to speak against stigma. And I'm so excited, I'm so happy because I hear of the human rights coming up to do a lot of work against stigma. Secondly, one of the ways to fight stigma is one of the things that has been happening. We've had testimonials from people that lived with the disease come up on air, come up on social media to say, I have had COVID-19.
I think we need to encourage more of those people to come out, Doctor. But having said that, we have to close. Thank you so much for being such an animated speaker this morning. And thank you, all of you watching, for being with us. Now, call this toll-free number. Yes, thank you so much, Dr. Kiladejo. Call this toll-free number for help if you or people you know have a fever or other symptoms of COVID-19. Please feel free at any time to go to channelstv.com/podcasts to enjoy an audio version of the program if you missed it, are commuting, or just want to listen all over again. Thank you so much for watching. Have a wonderful day. Stay safe. I am Mary Alale Yusuf.